So, what are your thoughts then? This is a question that a lot of women too are not aware of: is hormone replacement therapy traditional versus bioidenticals? And what is your opinion on the two? What if someone, should they be aware of the differences, ask their doctor about certain things, uh, other misconceptions about them?
Oh, one of the big and I think unfortunate misconceptions even within the functional medicine world is, is bioidentical estrogen different from estradiol that's prescription? And it's actually not. I mean,
Mm.
estrogen is estrogen. And so if I give you a prescription for estradiol, estrogel, for instance, it is the same thing as my bioidentical compounded estrogen. And unfortunately, I think because of that, it's created this divisiveness in the medical community where they're like, like where the regular docs hate the functional medicine docs who are, touting you have to be on bioidentical hormones when really honestly their own estrogen is the same thing we're prescribing. The difference is that I can use much more refined um, dosing, right? So I can dose it differently as opposed to the compounded or the non-compounded. But estrogen is estrogen. Estradiol is estradiol. It, there's no bioidentical estradiol versus normal estradiol. Estradiol is the same exact compound. Where the bioidentical becomes much more critical is in progesterone, because bioidentical progesterone is not Premarin, which is what's used in the pharmaceutical world as progesterone. So that's what's in your birth control pills. And that's what was, in the old, menopause medications. So basically, that Premarin is not at all progesterone. In fact, it doesn't fit in the progesterone receptor. It has, if you look at the two structures, they're different. They do not, it's made from pregnant mare urine. That's where it got its name, Premarin. So it basically is
Wow.
made from these
Okay.
stress. They actually, it's horrible. And if nothing else from an ethical standpoint, they take these poor pregnant horses and they keep them in these little bins. So and they collect their urine. They calf them and collect their urine, and that's where Premarin is made from. So it honestly is has a very different effect on our bodies, and it has a carcinogenic effect. And it's where, unfortunately, a lot of the studies, when you look at the studies and you look at what they use as hormone replacement, they used estrogen. Yes, that's probably the same, but Premarin is a bad player, and it causes drive even of the estrogens down different pathways. So that's where that difference lies, and that's where you really have to be careful. And then testosterone really isn't made in any kind of dosing. So there's testosterones for men, so there's testosterone gels, things like that. Again, they are testosterone cypionate, just like the testosterone we use in general. They really don't make them in the doses that we need for women, and so that's difficult. And then honestly, it's actually usually less expensive to get the compounded medications than it is like a prescription estradiol. The
Huh.
other piece of estrogen is estradiol only comes as estradiol, and sometimes I'll put women just on estradiol. But sometimes, particularly sometimes if they have a really high breast cancer history, or I just can't change their drive of pathways, I'll use a little bit of estriol. Remember, I said the estriol was a very protective estrogen. Sometimes it can have a few more, like women will get a little bit more breast tenderness and things like that. So be careful with it. But so sometimes you'll use you'll use a percentage where you'll use some E2 and some E3 mixed together. So it's a little bit, let's put a little bit of this, a little bit of this, so we can make sure these pathways are going in the right direction. Because estriol actually does have such a protective effect. For a while, people advocated just using estriol, just use 100% estriol, but doesn't really convert well down into some of the more necessary pathways. So then they went into using percentages, and I think that works. But I think that sometimes you have to, so for instance, Biest, which is the most frequently compounded bioidentical estrogen, is a combination of estradiol and estriol. That's why it's called Biest. It's two estrogens, right? And for some women, that works great. That's probably the most go-to compounded estrogen. But for some women who are complaining when they're put on their bias by their functional medicine doctor of a lot of just side effects from it, sometimes you have to back down on the estriol.
Mm.
So that's where that kind of refinement really comes in, and understanding the metabolism of it. But
Yeah.
but I really do want people to be a little bit more aware, because I do think, you know, that we have to sort of stop this divide that the traditional medicine doctors think all the functional medicine doctors are quacks. And part of that comes from this, well, hormones are hormones, because in one sense they are. So yes, bioidentical hormones are better. It's because of the progesterone. And it's because I can dose them appropriately. It's because I can refine the treatment. But estradiol is still estradiol. So I think that that's confused even in the functional medicine doctor world, quite frankly.